Hello and welcome to this presentation on the student support services that we offer to students at Leicester Medical School. My name is Lisa Quinn. I'm a lecturer based at the medical school. I teach mainly students in the first 2 years of the course, and I'm also a personal tutor to a number of students in years 1 and 2, and I'm also involved with the academic support unit and see a lot of students through that service. So the student support services that we provide to our medical students at Leicester Medical School can be broadly divided or split into 4 key areas, and that relates to our personal tutoring system, the services that we offer through our pastoral and academic support units, and also a number of student-led support services as well. I think it's important to add just at this point is that these support services are in addition to those that are more centrally offered through the university generally to all University of Leicester students. So these are additional sources of support that we provide to our medical students in particular. So I'm going to focus first on the personal tutoring scheme. All our students are provided with a personal tutor. That is usually in the first 2 years one of our teaching staff that's based at the medical school. The personal tutoring scheme differs slightly as they enter phase 2 or years 3, 4 and 5, and that the tutors are called clinical academic tutors and they take on sort of the personal tutoring responsibilities for students from their 3rd year onwards. So in terms of what the personal tutor scheme offers, particularly in phase 1, it really is providing a professional friend for students to help them navigate a lot of the processes that they'll be engaged with when they're at medical school, and to be on hand really to provide help and advice and guidance whenever that's needed. The advice and help that personal tutors can provide can be anything around academic related issues, but also provide an ear to students to discuss personal health and well-being issues. And sometimes there may be circumstances that perhaps a student requires more support in terms of academic and pastoral or personal health and well-being issues beyond what the personal tutor role is able to provide. And as such, the personal tutors can signpost to more appropriate services such as our academic and pastoral support units where necessary. Students at the medical school will also, as the years progress, start to increasingly engage with something called an e-portfolio. And an e-portfolio is essentially an online record of a number of skills and competencies that students acquire over their time. And also a portal in which students can store a number of reflective writing pieces in relation to some of the activities and some of the patients maybe that they're seeing over the course of their studies. This is quite important because when students enter the postgraduate world of medicine and start working as doctors, one of the expectations of their professional practice will be to maintain an e-portfolio that acts as a record for their ongoing professional development. So it's important that we establish good professional practice and habits very early on within the course for our students. So what else can students expect from their personal tutor? Well, first of all, the personal tutor will take responsibility for establishing that initial contact with the student and also arranging sort of subsequent one-to-one meetings that will occur regularly over the academic year. Those meetings, particularly in years 1 and 2, tend to occur at the beginning of a term or a semester and also before and after an exam. In the meetings that occur following an exam, there is an opportunity for the personal tutor to sit down with the student and help them reflect and think about their feedback on their performance and how they can use that moving forward in terms of the following semester. As I've already said, the personal tutor is a point of contact that can assist the student in understanding certain medical school policies and procedures, and also be on hand to provide that general academic advice and support. As I've said, there will be instances where there are certain situations, whether that's academic related or pastoral related, that are beyond the scope of the role of the personal tutor, and the personal tutor then can signpost to other appropriate support systems when necessary. Personal tutors can also act as an individual who can provide an academic reference, so providing advocacy for students, for example, during the course when they may be applying to get involved with some voluntary work, but also thinking about job applications later down the line when they're entering towards the latter stages of their medical degree. I think the final point really to add here with regards to the personal tutoring scheme is that while there are pre-arranged regular one-to-one meetings that are established throughout the year, the tutors are also in a position to provide advice and guidance, not just when difficulties occur, but also ad hoc, throughout the year. So students are encouraged to contact their personal tutors should there be something that arises that they simply want to go and have a chat with somebody about. So moving on to the second of our student support services, this is our pastoral support unit, or rather the picture on the slide is actually an image showing the reception area or the waiting area for our pastoral support unit. This space is shared with the academic support unit as well. And just down here on your right, this desk space area is where Leanne Phillips sits, who's the administrative support for both the pastoral support and academic support units, and is first point of contact really for students who come in requesting an appointment with a pastoral support or academic support member of staff. The two offices that you see at the back there are where the pastoral support team reside, and this is where they will see students on an individual basis for appointments that relate to any sort of health or well-being concerns or issues that students may present with. So just to briefly introduce some of the pastoral support unit staff, we have Dr. Sophie Parkinson, who's the director of the unit, but also regularly sees students who present to the pastoral support unit. She's a GP by background and has been supporting students for many years, since 2002, so lots of experience in providing support to students. She's actually a graduate of Leicester Medical School and is occasionally also working down at the emergency department at the Leicester Royal. Mrs. Oppenheimer is a consultant obstetrician who's also been involved with student support for over 10 years. Focuses mainly on supporting students within phase 2, so years 3, 4 and 5 of the course, but will also see students in the early years as well. She has additional interests in supporting students with specific learning difficulties, so for example students with dyslexia, and is the accessibility tutor for phase 2 students as well. And I've already introduced Leanne Phillips, who is the administrative support for, as I said, both the pastoral support but also for the academic support unit as well, and she liaises with students both over email and face-to-face with regards to making appointments, and is often that first point of contact. In addition to these key members of the pastoral support unit, there are also a number of staff who are also clinical module leads. So when students are in phase 2 and spending much more time out on clinical placements, the placement leads often provide that immediate support for any sort of pastoral issues and can refer the student back to the pastoral support unit at the medical school. So while the pastoral support unit is based within the medical school building, and that's where many of the pastoral support unit staff will be found, students can access this service throughout the entirety of their time at Leicester Medical School. Moving on then to the academic support unit and the services that this particular unit provides to students. The academic support unit consists of a number of academic support tutors who are led by Dr. Jane Burns, who's an associate professor in medical education and a retired GP. The academic support unit and the staff involved there work closely with the personal tutors as well as the pastoral support unit in ensuring a sort of a holistic and comprehensive support service to our students. Many of the academic support staff are regular teaching staff within the course, both in phase 1 and phase 2. And some of those staff will have particular expertise or knowledge of some of the certain assessments that occur within different years of the exam, so can provide particular advice around certain aspects of the course where necessary. So which students use our academic support unit? Well, basically any student is welcome to and encouraged to use the services that we offer through the academic support unit. We really do encourage students also to be proactive in seeking support and advice on their approaches to studying in higher education and also in medicine, and the additional demands that studying medicine can place on students' academic skills. Students can self-refer, they can attend in person, so a lot of our phase 1 students who are in years 1 and 2 will often pop up to the academic support unit, which shares the reception area with the pastoral support unit, and make an appointment in person, but they can also make an appointment over the phone or via email, which is particularly helpful for students that are in the later years of the course who might be out on clinical placement. Some students may be referred or encouraged to self-refer by their personal tutors or clinical academic tutor, which is what we call sort of the personal tutoring scheme for those in the later years. And any student who has struggled with a particular exam and has been unsatisfactory will be routinely referred and encouraged to follow up with an appointment to speak with an academic support unit member of staff. So if a student does make an appointment with the academic support unit, what will be offered is a one-to-one meeting. If this is the first meeting that the student has had with an academic support tutor, then the meeting will include an initial assessment of how the students are approaching their studies and if there are specific educational needs that the student might be looking for further support with. The academic support unit can also offer ongoing longer-term mentoring and support for a lot of our students. We will often see them for follow-up one-to-one meetings. And for students with particular academic difficulties, then we may see them a number of times over the academic year. We can also provide support with regards to exam techniques, so not only in respect to the written exams, but also the clinical OSCEs, which are more oral forms of examination, which require a certain set of exam techniques that are quite distinct to perhaps what they're used to in their written exams. The academic support unit has also been offering regular drop-in sessions throughout the semester. So for students who perhaps don't necessarily want a one-to-one meeting, but simply have a few questions or queries about how to approach their studies, then they are welcome to informally drop in through sort of designated sessions throughout the week for a quick chat with an academic support tutor. So students might wish to make an appointment with an academic support tutor for a whole host of different reasons. Often students want to come and have a chat about their study techniques and strategies, and whether there are ways in which we can support them in adopting more effective and time-efficient techniques, particularly given the demands on their time that students face with studying a course like medicine. Often they may also want to talk about note-taking approaches, and particularly in the context of making the most of their time in the lectures in the early stages of the course. As I've said, exam technique often factors into conversations that we have with students, as well as general time management skills, and really starting to reframe their perspective on taking responsibility and ownership for their learning, which is particularly demanded of them in higher education study. We sometimes do see students who are feeling quite demoralised and overwhelmed by the demands of the course, and we support students in identifying whether that is perhaps due to some of the study strategies and techniques that they've adopted, or perhaps issues around how they're managing their time. But we're also conscious as well that there may be some underlying pastoral or personal well-being elements that could be compromising students' abilities to engage and make the most out of the course. Hence why we liaise closely with personal tutors and the pastoral support unit to identify students where we are concerned that might be the case. So finally, coming on to some of the student-led support services. In the last few moments of this presentation, I'm just going to actually focus on a couple of those schemes that are offered, and that includes the Medic Parents scheme and the Mentoring scheme, both of which are initiatives that have been developed by our students and are coordinated through the Medical Student Society, or the LUSUMA group. So the Medic Parents scheme is where every student is assigned 2 medic parents when they arrive at medical school. The medic parents are essentially 2 students from the year above, and they really play a role in supporting students to settle in, and also as a sort of source of support throughout their time at medical school. Students are introduced and meet their medic parents on the first day of Freshers Week, and they will have continued opportunities to meet up throughout the year, and as I said, throughout their duration of their time at the medical school. Medic parents also can provide additional advice on studying and revision, and many will organise one-to-one revision sessions in the times around exams. So the Mentoring scheme is another student-led initiative which seeks to pair students who are facing particular academic difficulties. For example, maybe they've failed an exam, with students in the years above who will act as mentors. And those mentors will provide guidance and small tutorials, so that's one-to-one, sort of 1 to 2 hours of teaching fortnightly, focusing on particular areas of difficulty. And in addition to providing, obviously, that additional academic support to students, the students that act as mentors also have an opportunity to develop some of their teaching and mentoring skills as well. So just to conclude really and finish perhaps on a really important message that underpins a lot of the support services that we provide to our students, and that is to really encourage students to see seeking help as a strength. We know that there is an issue in the culture of medicine generally, but also often in students at medical school, that they don't want to be seen as struggling or needing help. And we really want to dispel that stigma, and get students to realise that they don't have to be perfect or indestructible, and they are very much human and face not only particular demands with regards to studying medicine in itself, but are also inevitably going to be facing particular demands that are faced outside of their studies and in life in general, that can have an impact on what they do. And we ask families to consider the balance between support and pressure. We know in some cultures seeking help may not be encouraged, but we really do want students to start thinking proactively about seeking support and help when they feel that they need it. And this is especially important not only during their studies at medical school, but also behaviour to start to embed as they prepare and go into working as a doctor, when inevitably they will face incredible demands on their emotional health and personal well-being, and know that it is entirely appropriate to ask for help and recognise when help is perhaps needed. So just to conclude, the student support services, I've talked to you a little bit about the personal tutoring system, as well as the additional services that we offer through our pastoral support and academic support units, and also the involvement of a lot of student-led support initiatives as well. So thank you very much for your time and attention. I hope that's been valuable and addressed most of your questions or queries that you might have had about the student support services that we offer. Take care, and I hope to see many of you face to face in September.